Hi everyone. Today, in the topic of salivary gland tumors, we are going to discuss about the pleomorphic adenoma. As in the earlier lecture, we have discussed about the introduction and their histogenesis with different theories of histogenesis. So, let's come to discuss about the pleomorphic adenoma. This pleomorphic adenoma, the name itself defined, pleomorphic adenoma means different types of morphological variation are seen in this tumor. Okay, so this tumor is also called as mixed tumor, since because of the different types of morphological variation they show mixed appearance, so this tumor is called as a mixed tumor of the salivary gland. This tumor is also called as Enchondroma branchioma, means this tumor is an encapsulated tumor, Enchondroma branchioma tumor, and it is also called as epithelioma and Enchondroma. Because this tumor, when you see in the histopathology, you will see there is a cartilaginous portion in this tumor, means there is an osseous portion in this tumor, so this tumor is also called as Enchondroma. Now, come to the pleomorphic adenoma, the introduction portion. How you will write in the examination? First is the introduction portion, then the histogenesis, then you will write the clinical feature, then you will write the histopathology, and then differential diagnosis and the treatment plan. So let's come to discuss about the introduction of this tumor. This pleomorphic adenoma is a very rare benign tumor of the salivary gland. Means this tumor is very rare in the salivary gland. They are very less frequent observed in the salivary gland. They are benign in nature, means they do not metastasize. Yes, they have the potential. They can in future, with a long-term standing, can be neoplastic. They can metastasize, but initially, in a short duration of period, they are benign in nature. So, this tumor consists of cells that exhibit the ability to differentiate to the epithelial cell and mesenchymal cell. Means this tumor has some cells. You all know in the introduction I have told you about that there are two cells. They are epidermoid cells and the interductal cells. So this tumor has some cells, that is epithelial cells, that is ductal and non-ductal cells, and mesenchymal cells. They have the cell which has opportunity, they have the ability to get differentiated into these two cells. That is chondroma, myxoid and osseous cells. Already discussed why we call it as Enchondroma. So this tumor has some cells which have the potential to get differentiated into the chondroma cells, cartilaginous cells, osseous cells, bony cells. They have the tumor. The name, they are generally asked in the viva, who suggested the term salivary gland pleomorphic adenoma tumor? The answer will be Willis. Willis was a scientist who discovered this tumor, who suggested the name of this tumor that it is the pleomorphic adenoma. Then, the most common benign neoplasm of salivary gland. This is the most common benign neoplasm of salivary gland. Don't be get confused that it is rare. Yes, it is rare. But if we find that some tumors are there in the salivary gland which are benign, some are carcinomic, means some are malignant. So you will find that out of all the benign tumor that occur in the salivary gland, this pleomorphic adenoma is very much common in nature. But overall, the salivary gland tumors are rare. So the origin of this tumor, yes, always we have to write about the origin of any tumor. So the origin of this tumor is epithelial and the intercalated duct cells. Yes, the two cell theory, that is basal cell theory, you know, or the prevalent potential theory. According to this two theory, we have discussed that the two cells are very much common for the origin of any tumor of the salivary gland. So here also the epithelial cell and the intercalated duct cells are very much common for the origin of this tumor. Then the morphological complexity. The morphological complexity is the differentiation of the tumor. Means already discussed the first line of our discussion today that this tumor is very much morphological differentiation, very much morphological variations are seen in this tumor. So the differentiation of tumor like fibrous, hyalinized, myxoid, chondroid and even osseous areas are the result of metaplasia. Means this tumor can metastasize, but because of these things like fibrous tissues, hyalinized myxoid tissues, chondroid cells, osseous areas are the result of metaplasia, means they have metastasis. Now, tumor is geratomatous, that is derived from more than one type of tissue. This tumor has derived from more than one type of tissue. Yes, we have discussed pleomorphic, means they have more than one type of tissues are there for the origin of this tumor. So they are called as teratomatous tissue. Teratomatous tissue. Histogenesis. The histogenesis of this tumor is myoepithelial cell and the basal resorption cell in the intercalated duct. Means this tumor has the histogenetic theory of myoepithelial cells and the basal resorption cell duct or interductal cells. The presence of both ductal and myoepithelial cell in the pleomorphic adenoma, that is, in this tumor there is both myoepithelial cells and the interductal cells are the very much common in this tumor. Means these all are the morphological variation. Yes, the different types of cells, different types of appearance. These all are the pleomorphic variation. Hence, this tumor have these are present. Both have the role in the histogenesis of this tumor. Yes, the myoepithelial cells and the ductal cells have the morphological variation and have the role in the histogenesis of this tumor. Now, the morphological diversity. Why there is morphological diversity in this tumor? I told you, but let's come to discuss that the myoepithelial cell, including the production of fibrous, mucinous, chondroid and osseous areas, means this tumor has some level of morphological variation, and this is because of the myxoid cells, myoepithelial cells, osseous cells and chondroid cells. Means there are some cells present in this tumor and due to which there is some morphological variation. The intercalated duct cell responsible for differentiation into the ductal and myoepithelial cells. जो intercalated duct cells होते हैं, they are responsible for the differentiation into the ductal and the myoepithelial cells. Yes, we have discussed the pleomorphic adenoma have originated from the intercalated duct cells mainly. They have the role of the myoepithelial cells, but the main role of the intercalated duct cells. So, later, these ductal cells can undergo mesenchymal metaplasia. This mesenchymal metaplasia will be seen in the case of histopathology and because of the smooth muscle-like property. Because this myoepithelial cell has smooth muscle-like property, so they can metaplasia, mesenchymal metaplasia. Histogenetic precursor of the pleomorphic adenoma is intercalated duct cells. Discuss. Pleomorphic adenoma can be because of the cytogenetic and rarely epithelial also. When altered, there is abnormality chiefly involving the chromosome number 12, Q, 13 and 15. Means there will be some cytogenetic alteration in this tumor. So this tumor can also originate from the cytogenetic alteration, and that will be because of the 13q, 12q, 13 and 15. This P and Q what resemble? They resemble the short and long arm of the chromosome. Then the putative pleomorphic adenoma gene. There can be alteration in the putative pleomorphic adenoma gene PLAG1. So this can be the introduction and the histogenesis. Now let us come to discuss about the clinical feature of this tumor. The clinical feature of this tumor, as we always discuss, age, sex and size, then some feature and appearance.
So in the age of occurrence of this tumor is 4 to 6 decade of the life. This tumor generally occur in the 4th to 6th decade of the life. Okay. Generally, the mean age of occurrence is 43 years. Young adults in the children are more commonly affected with this tumor. But in the children, the most common is the myoepithelial carcinoma. Don't forget it. Then the sex. Females are more commonly affected with this tumor than the males. The ratio is 3:2. The site. The major salivary gland tumor are more commonly affected. Major salivary gland are more commonly affected like parotid, sublingual, submandibular. But out of all these, the parotid are most commonly affected with this tumor. Then the palate, then the soft tissue, then the minor salivary glands like buccal, labial, etc. So this was the clinical feature. Then we will come to discuss about the appearance. This tumor is painless mass. ये जो ट्यूमर होता है, this tumor is a painless mass. They are very much rare and they are found in the like a lump of mass. So in the next few seconds we will discuss about the clinical feature in detail and then the histogenesis. So in the next, the clinical feature, the occurrence in the sublingual gland is very rare. Means the salivary gland tumor when occur in the sublingual gland, it is a very rare chance. So in the parotid, this tumor is very much common, and in the parotid, this tumor is in the lower pole of superficial lobe. Means you know the parotid gland has two lobes, the superficial lobe and the lower lobe. So in the superficial lobe, मतलब कहने का क्या है कि जो सुपरफिशियल लोब है उसके लोअर पोल के पास दिस ट्यूमर कैन बी फाउंड एंड एज अ मास this tumor can be present at the angle of mandible. So this tumor can be present at the angle of mandible and below and in front of the ear. Means below and in front of the ear. Means this tumor as a whole can be told that this tumor is present near the angle of ramus of mandible. So the 10% rise in the deeper portion of the gland means this tumor always have a 10% rise. 8% involve minor salivary gland means the 8% of the pleomorphic adenoma involve the minor salivary gland, and palate is the most common site for the minor salivary gland. Means out of all the areas of minor salivary gland, this palate portion is the most common site for the minor salivary gland. Now, this chart is very helpful to you when you are discussing yourself or you are revising the pleomorphic adenoma during the last minutes of examination. So try to make chart like this, like pleomorphic adenoma. This pleomorphic adenoma start from here is an irregular nodular lesion. Means they can be ovoid, round, irregular, means they do not have a particular shape of the tumor. They can be small. This tumor can be small. This tumor can be painless. Means this tumor will be small, but with the time this tumor can enlarge. This tumor is initially painless, but when it gets secondarily infected, they can be painful also. Now, this tumor is slowly benign to increase in the size. Means धीरे धीरे ये benign होते हैं और धीरे धीरे साइज में इंक्रीज करते हैं. Areas of cystic degeneration can be found in this tumor. Means there will be a space where the cell will get necrosed or they will get degenerated. That will be an empty space or the cystic degeneration can be found in this tumor. They may rarely ulcerate. this tumor can rarely ulcerate, the tumor can rarely have some bleeding, or they can rarely be a painful lesion. The lesion with the time can weigh several kg, means with the increase in size, the weight of the tumor can increase. It's common. The recurrence of this tumor. The recurrent tumor will be multinodular, fixed on palpation. When will you palpate this tumor? It will be multinodular, means there will be small nodules, and in the tumors of thyroid you will also study that there will be multinodular thyrotoxicosis. So the same like here, that this tumor can be multinodular, small nodules can be present in a large area, and they will be fixed on palpation. The facial nerve involvement, since you know the branch of facial nerve will supply to the parotid gland or the salivary gland, so the facial nerve involvement with the compression of the facial nerve, and once you know when there is compression of the facial nerve, then there will be facial nerve paralysis. Intraoral lesion. The intraoral lesion size is about 1 to 2 centimeters, 1 to 2 centimeters, and with the time they can increase their diameter. This tumor can be big and can cause discomfort. Yes, when this tumor increases in size, think just like a layman that if there is any hard area or a big size is there, once it becomes bigger with the size, can you masticate? No. There will be difficulty in the mastication, there will be difficulty in the frequency of speaking, there will be difficulty in talking, there will be difficulty in eating. So these all are the some features, and as a manifestation, anemia, this condition can occur, weakness can occur, because there is difficulty. The patient may feel very fear that I should not eat because there will be pain here, there will be pain. So the patient will not eat, and at a time the patient will feel difficulty in swallowing. Now, the tumor can be encapsulated. So this tumor has well-defined margin with an encapsulation. Means this tumor can be encapsulated, means their removal is easy. The palatal pleomorphic adenoma. The palatal pleomorphic adenoma is fixed to bone, means already told just few minutes earlier to you that this tumor has involvement of bone. So the palatal involvement, palatal tumor, salivary gland tumor can involve the bone also. Now, the tumor is easily movable and easily palpatable. This tumor can easily move to you. Please do like, share and subscribe to our channel Oceanofdentistry, and not forget to press the bell icon for more updates. The link of old videos are given in our description, and how you can contact me is also given in the description. So please do like, share and subscribe. And that is all for today.